Okay, so let's dive right into a topic that's super interesting and, honestly, pretty complex: gestational diabetes. To really get our heads around it, we have to start with a question that sounds, well, a little strange. I know, it sounds totally backward, right? Why on earth would the body do that to itself? But stick with me, because this paradox, it's the absolute key to understanding the incredible metabolic shifts of pregnancy and what happens when that delicate system goes a little off-kilter. You see, every single healthy pregnancy involves this fascinating challenge. The mother's body actually creates a state of purposeful resistance to its own insulin. It's actually a brilliant biological move. By becoming less sensitive to insulin, the mother's own muscles and fat cells don't soak up as much glucose after she eats. And what does that mean? Well, it leaves more sugar circulating in her bloodstream, ready and available to get shuttled across the placenta, straight to the growing baby. So let's be super clear here. This insulin resistance isn't a problem. It's a feature, not a bug. It's a completely normal, totally necessary adaptation to make sure the fetus gets all the energy it needs. But just creating this resistance is only one half of the story.
Because the body can't just let blood sugar levels go haywire. That would be dangerous. So how does it deal with this resistance it created on purpose? Well, this is where the body's incredible metabolic balancing act really kicks into high gear.
Just look at this. In the back half of pregnancy, a mother's sensitivity to insulin plummets by a whopping 40 to 60%. That is a massive metabolic shift in a really short amount of time. It puts a huge, huge demand on the system. And this here lays it out perfectly. You've got two things happening at once. On one side, you have the muscle and fat tissue basically ignoring insulin's call to soak up glucose. And on the other side, the pancreas is like, whoa, okay, I see what's happening, I've got to step up. And step up it does. To keep everything in balance, to keep the mother's blood sugar in a safe range, the body's little insulin factories, the beta cells in the pancreas, go into absolute overdrive. We're talking a 200 to 250% increase in insulin production. It's just an incredible feat of biology. But what happens when that balancing act fails? What if the pancreas just can't keep up with that insane demand? And that right there is the core of gestational diabetes. This is the most important part. It's not that women with GDM are necessarily more insulin resistant than other pregnant women. The real issue is that their pancreas can't produce that massive 200+% surge of insulin needed to overcome the normal resistance of pregnancy. And the research totally backs this up. This quote really hits the nail on the head. Scientists see GDM as a problem of inadequate insulin secretion. The beta cells, for some reason, just don't have the capacity to meet the extraordinary challenge that pregnancy throws at them. Okay, so what about the placenta in all this? It's not just sitting there as a passive barrier. It's a major player, and it gets really interesting when you see how it reacts to this high-sugar environment. You got to think of the placenta as the ultimate gatekeeper, right? It's in charge of every single building block that gets to the fetus, and its behavior changes completely depending on what's happening in the mother's body. So, in a GDM situation, with all that extra sugar and other nutrients floating around, the placenta basically opens the floodgates. As you can see in this table, the little transport systems that pull in glucose, amino acids, and fats all get ramped up. They go into overdrive. This creates an oversupply for the fetus, which can lead to it growing too large, a classic sign of GDM. Okay, so that leads to the big question, right? Why can some pancreatic systems handle this incredible demand while others can't? Well, the answer isn't simple. It's a whole web of underlying risk factors. Yeah, GDM doesn't just pop up out of nowhere. As this chart shows, it's a mix of your own individual biology, your environment, and even socioeconomic factors. It's complicated. Let's just zoom in on a couple of key biological pieces. So one piece of this puzzle has to do with hormones that come from our fat tissue. In women who get GDM, we often see lower levels of a hormone called adiponectin. And that's a good guy. It helps your body use insulin better. At the same time, they often have higher levels of leptin. This combo creates a hormonal soup that really favors insulin resistance. But maybe the biggest aha moment in all of this is the genetic link. Gestational diabetes is not some random pregnancy thing. More often than not, it's unmasking a pre-existing genetic tendency towards beta cell problems, a tendency it shares with type 2 diabetes. And when scientists dig into the genetics, they find the same culprits over and over again.
These genes you see listed here, they're well-known players in the world of type 2 diabetes. They're basically parts of the instruction manual for running those insulin factories we talked about, the very system that gets pushed to its absolute limit during pregnancy.
Which brings us to our final and maybe most important takeaway. Think of pregnancy as a metabolic stress test. It's like putting the body's entire glucose-regulating system on a treadmill and cranking it up to max. For some women, this test reveals a hidden weakness, a vulnerability that might not have shown up for years or even decades otherwise. And that's why getting GDM is such a powerful signal. It tells us there's a much higher risk for developing type 2 diabetes down the road, and it really underscores why that follow-up care after the baby is born is just so important.